Fred, what do you think of this? Is this a technique that you're familiar with?
It's not something I've used, or I've read some about it. Actually, that's the best description of it. It's sort of akin to therapy in a sense that therapy teaches you how to rethink certain things. It's also sort of akin to working out. What you're doing is working out your focusing instead of working out your legs. And so these activities are really focus activities. We have done that with kids for a long time. We've never had a system before where they could self-monitor. Earlier I said, successful treatment of ADHD is about teaching kids to self-monitor what they do. This is a vehicle for doing that. I don't have the knowledge or experience, obviously, that Roger has, but I know that that's the direction we need to go. I know medication is necessary. I'm not anti-medication. In fact, I'm for medication. But I know that just medicating kids, which is more of what I see than I don't see, is a problem. The message that parents need to hear and people who have ADHD is medication is necessary but not sufficient. So you must do the other things. And self-monitoring, self-regulation is a key to everything you read about curing, I liked your word, but being able to function effectively in society. That's what I would consider a cure.
Well, do people with ADHD or children, do they have to take medication forever? Is this something that they can never stop taking?
Well, great question. Which book of mine do you want to read? The 75 book said you can stop at adolescence. The new stuff says you need to medicate adults. I think you need to switch the meds. I'm very concerned about giving adolescents psychostimulants.
Why is that? Why are you concerned about that?
Because of the potential for misuse.
For drug abuse, you're saying?
Right.
But if we're talking about changing or the impulse control, we know that adolescence is typically when that impulse goes out the window and they begin to do things on impulse, like try alcohol or try drugs.
Well, and look at the incidence of people who are either diagnosed or undiagnosed ADHD or substance abusers. I mean, there was a whole period of time when people had ADHD used marijuana to control their symptoms.
Mm-hmm. They were self-medicating, essentially.
Self-medicating.
Right.
Some children, adolescents use alcohol. I don't want that medication. And then I'm worried about them mixing alcohol with psychostimulants. There are all sorts of dangers involved in doing that. It's not that they don't need it. I just think it's harder to monitor adolescent behavior in the best of judgment children, but ADHD children tend to be impulsive and they tend to make poor judgments.
The point about self-medication is very interesting because there's been correlation between drug abuse and ADHD, but what you're saying is these are kids who have found a way to medicate themselves. Is that what's going on?
Oh, if you know, the days when I was a therapist and you talked to kids who were marijuana users, they would tell you, I mean, I cannot go to sleep until I have a joint. Mm-hmm. And when you think about it, what is the symptom of ADHD? Difficulty falling asleep. Well, what does marijuana do? It makes you tired. So there were a whole lot of kids who I would see in therapy who were referred for marijuana use or alcohol abuse who were actually self-medicating conditions of ADHD. I think it goes back to what Sue was saying earlier about you really need to get the whole picture.
I found, when you talked about the 70% rule, I found that fascinating, that kids with ADHD are really 70% of their age in terms of social circumstances, which I had never heard before. And I'm wondering, Sue, do families understand that? I mean, if that would be incredibly helpful, and if these kids, not just attention problems, but real social problems, right, because they're not, socially, they're not the age they should be, that would really add to this problem.
That's part of the education that needs to happen with parents, and that's a lot of what I do in my office is we talk about, you know, I think sometimes parents don't know what the ADHD meds are supposed to treat. they think that all of a sudden all of the problems that they've associated with ADHD are going to go away. And I even had a mom at one point talk about how even though the child was on medication, she would not stop sassing. And I said, this is not an anti-sass pill. This is an ADHD medication pill. And so to make them understand and give them information about what these medications do treat, as opposed to, they don't, it's not a magic pill.
Well, it's
a lot
kind
of
of
things
scary.
aren't going to go
The parents would
away.
think, oh, this pill is going to make my child a perfect
Right,
child.
right.
Well, even better, my kid's on the medication, his grades haven't gone up. And the answer is, yeah. How did you think that was going to happen? In school, I'm amazed that parents think when the pill comes, and even if it's the right pill, not mention that, how hard it is to
Right.
get the right dosage and all of that, that everything's going to go away. That's been sold to them inappropriately. I think there was a feeling in America in the 90s that the medicine took care of the problem, that it treated it like an infection or something, and it's not what it does.
Let's talk about how difficult that is to get the right dosage, because is there real danger here that kids might be over-medicated or take too many medications, or does that happen often?
That's a real scary thing for me, because often I get parents who have come in after the child has been medicated somewhere or another, and the original meds didn't work, and so they were given more meds, and there was a layering, of more and more and more meds, and at some point the parents get very angry or frustrated. My child is on all these meds, they're not working, we're not doing it anymore. And so my concern is that they won't accept any kind of treatment when the child does need something, but that particular med may not be working, or there may be a misdiagnosis. We were talking about missing the anxiety parts or the depression parts. They may be successfully treating the ADHD, but they may not be treating at all some of the other things. So no matter what med they give for ADHD, it's not going to help the other symptoms. But if there is a bad reaction, or there is the med's not working well, or it's not what they expected, the parents will often then say, we're not doing anything else, and then the child doesn't get any further treatment.
What do you see as the future? What's the future for ADHD? What's the future for diagnosis, for treatment?
Well, we're getting better and better. I think there's a greater awareness that the pill doesn't do everything, the medication doesn't do everything, so I think that's real good. Science is giving us more factual information. So a lot of things that we knew intuitively in the 70s, give the kid Ritalin. We now know why it's up and down. We now know how long it works. We now know we need long. So, as always, science is giving us the answers to questions. That is one of the nice things about having National Institute of Mental Health, studying mental health, while we are out there dealing with it every day, because somebody has to go look at it from a very scientific, objective, data-driven, and that is helping us. That is clearly helping us. The medications are more varied, and now that's more problems, because that means, can I try this, can I try that, do I add this, do I add that, what's the right combination? But it also gives us some options. So I think that's an example. I think what Roger's doing is another example. 10 years ago, the science wasn't in place to do that. So you have to have people who are coming up saying, the problem's self-regulation. We know from biofeedback you can self-regulate. Surely we could apply this to the frontal lobe. Let's find the technology. And the other thing that we haven't even talked about is, as computers has changed the everyday world of all of us, it has certainly changed treatment, because even some of the assessment instruments monitor the response of the child. So I think, as always, science makes better. It doesn't solve all the problems, and it certainly creates problems on the way to solving them, but I think the future is much better. And I think public awareness is better. I think programs like this that say, let's look at the big picture.
Exactly.
Let's look at everything are very beneficial to people in society.
I want to thank our guests, Fred Krieg, Sue Meeks, and Roger Wilkens, for joining us today to talk about ADHD treatments. For upcoming episodes, viewer feedback, and links to important information, log on to our website at the address that appears on your screen. Thanks for joining us on Health Vision, a production of WOUB Public Television.